realized my sound quality's been not the best, so hopefully this helps a little bit. Maybe y'all can hear me a little bit better now. It's probably my phone case, and if this doesn't work, I can likely use my earbuds. Okay, starting off with nutrition. There we go. What to feed a dog? Well, there's many things you can feed a dog, right? And there's many reasons why a dog would get different foods. Smaller dog, larger dog, less active dog, more active dog. It kind of just depends. Now, the professor was saying that there's no best diet for all pets, but I tend to disagree with that. A diet without toxins is likely to be the healthiest diet you can give to a pet or to yourself. But, well, having a veterinarian that knows that is the first step. So, not all diets are the same. There's cheap diets, inexpensive diets that have lots of years of testing behind them, rigorous scientific testing on live specimens, right? They've got clinical trials. But there's also expensive diets that have the same thing, and then there's also cheap things that have no research behind them, or expensive things that have no research behind them. Cost does not equal quality. You can have a cheap diet that's high quality, or you can have an expensive diet that's very low quality. It doesn't necessarily translate. Now, what you want, if you're feeding your pet, here are things to consider. Whatever food you're feeding. Is the food safe? Number one, is it safe? Is it nutritious? Is it appropriate? Why does it have to be safe? I mean, that one's kind of obvious, right? You don't want to kill your pet, okay? Why does it have to be nutritious? Well, same deal. You don't want to kill your pet due to starvation, right? And appropriateness, that's kind of unique, right? Are dogs made to be vegans? I don't know about that. How do I get more in shape? Here's what I would recommend. Diet, exercise, sleep. Have a great diet, have a great exercise routine, and have great sleep. Those are some of the best things that you can do for good health, in my opinion. You're welcome. Hello. It's cool. I didn't know people were watching me from Uzbekistan. That's awesome. All right, back to this. Is it appropriate? So why? Why are dogs not vegans? Why are they not herbivores? Well, it's their digestive anatomy. They've got a stomach. What is a stomach good for? Well, what is it full of? It's full of acid. What is stomach acid good for? Turns out it's actually really good for breaking down protein. So most animals with a stomach are genetically they're biomechanically geared towards, I guess. They're biomechanically geared toward digesting proteins. Well, guess what has a lot of protein? Meat. Sure, there's some plant foods that have a lot of protein, but not all those plant foods are as high quality proteins as meats can be, or eggs. Eggs have very high quality protein. Whey protein in milk is, well, I mean, it makes sense because it's all over the supplement area in stores. Very high quality protein. Hey Parker, how's it going? Okay, and then back to this. So is the food safe? Does the manufacturer have appropriate quality and food safety procedures? I'm doing all right. I am currently reviewing and studying for vet school. And right now I am looking over my nutrition notes. Next I'll be looking over either immunology or CCC, which is clinical reasoning skills, and it's clinical reasoning, clinical skills, and something else clinical, I think. I don't know. I can't remember. Anyway, right now I got to do this nutrition stuff. Okay. Why is it important that the manufacturer has appropriate quality and food safety procedures? Well, we don't want bacteria, we don't want mycotoxins, we don't want pesticides or herbicides, we don't want heavy metals, and we don't want contaminants in our food. However, I'd like to point out, this is an anecdote from me, not from my professor, that most of those problems are commonly related to plants, actually. Yes, there are cases of salmonella in chicken, right? There are cases like that, but more often than not, why? I mean, no, I've never heard of a cow getting sprayed with an herbicide, right? I mean, cows don't need herbicides. They're not herbs. They're not herbs, or however you say that. They're not plants. Now, they might get some pesticide applied to them, I guess, like bug spray, but, I mean, still, I think it's unlikely. Pesticides and herbicides are more common for plants. Plants require a lot more water to cultivate en masse, meaning if you're cultivating a lot. One example is avocados. I learned this just the other day. Avocados take like 80 gallons of water. I can't remember if it was for like one avocado or what, but it was a lot of water for them things. Mycotoxins, common in, well, have you ever heard of aflatoxins? I think those might be different than mycotoxins, but those are found in peanuts commonly. Myco just is a general term for fungal toxins, because myc means MYC, not M-I-K-E. MYC is, it might be MYCO. Myco is the Latin prefix for fungal things relating to fungus. And so think of like words you might have heard before, mycelium. That's the only one I can think of right now. Anyway, is the diet nutritious? Like I was saying, you want a diet that's digestible. You want a diet that's got, preferably that one that has research behind it. and things that have been tested, things you want the appropriate amount. You don't want to hurt your pet by feeding it something it doesn't need, or by feeding it something that it can't have, like grapes. Pretty sure grapes can be toxic. I'm not certain yet because I haven't gotten to that point in vet school yet, but grapes, chocolate, I've heard that chocolate can be toxic. Okay, and then is it appropriate? Is it appropriate for the pet's life stage? Senior pets might need something a little different than what they've had all their life. If they are having kidney failure or liver failure or some other kind of failure because they were eating, well, in my opinion, a bad diet as a young pet, and it just took them some aging until their body was starting to break down because of that, then yeah, you might need to change it to a higher quality diet. But in my opinion, it's better to do that when they're young rather than when they're old. Because then you save a lot of money. You don't have to take your dog to the vet as much for pills and surgeries, that sort of thing. Any other medical considerations? Like I was saying, an animal can have kidney failure, that sort of thing. And one of the biggest considerations is the price or the value acceptable for the owner. This is something I'm dealing with right now. I'm a college student, I'm broke. I can't exactly be eating ribeye steaks every day. Wish I could. That'd be delicious and nutritious and healthy. But I'm having to stick to turkey and eggs right now. That's what I've found is relatively cheap and affordable for me. Okay. Yeah, convenience is a big one. Because owners, another thing is, who wants to spend hours preparing these foods all the time for their pet? Not me. I don't want to spend hours preparing food for myself anyway. Like, otherwise, why would I don't want to spend that time on myself. Why would I want to spend it on my pet? That's just me though. Some people like to cook. I do like to cook. It's just I don't like the time involved in it. I do like the experience though. Some brands have nutritionists, that sort of thing. Is it adequate? Who makes it? If the pet has thrived on the food, then it's probably a good food. At least for some life stages, like I was saying. Breeders, veterinary nutritionists, yeah. Okay. Okay, and then requirements change again in life stages, like I was talking about. When an animal's a puppy, they're growing, right? Maybe they need more food. When an animal's pregnant or lactating, they need even more food because they need tons of energy to make that milk or to generate that living organism that's inside of them. They're giving the nutrients that they are ingesting to that organism. And then when an animal gets older, it's already generated all the muscle that it's going to generate, most likely. It's already grown all that it can, so it's probably not going to need as much as a puppy. Okay, and then body condition score of 5 is ideal, of course. Which means some fat is necessary to have on the body of your pet or on our body. Here's the thing. If I had 0% body fat, I'd look like a skeleton. So I've got body fat on me, but I feel great. I'm not going to the hospital every day. So it's not a crippling thing to have some body fat. Matter of fact, I think I said this yesterday, but it's around 12 to 20% for humans, I think, is the ideal range. I think. I don't know. I could be wrong in that. There's also other things to consider with your pet. I've already mentioned a couple of these. Age. Here's another one. Breed. Some breeds react differently because they've got certain genetic predispositions to other or to diseases, that sort of thing. If your animal is spayed or neutered, is definitely a factor. They've got down regulation of hormones or complete lack thereof. Think about it. When you castrate a dog, you are removing its testicles, and so you're removing probably 99% of its ability to produce testosterone. Testosterone is a very anabolic hormone, which I need to review, but I think anabolic and catabolic. Anabolic means like building muscle, catabolic means breaking down muscle, or it might just be building versus breaking down of tissue. I don't know. Anyway. Yeah. Okay. And then, okay, another thing to consider, you might just be trying to be efficient with your finances. And if you got pets, that can make it a little more challenging. Carbohydrates are cheap. It's true. There's a reason they're cheap. It's because they're low quality nutrients, but they're still nutrients somewhat. And so if you feed a young dog those nutrients and they don't die, you've still got a pet. They're not dead. And then as they get older, you feed them higher quality stuff. Again, this is not what I would recommend. I would recommend feeding it high quality food for its whole life, because that just seems to be the most humane option to me. But, I mean, broke is broke. Okay. Giving your animal water is important. Energy, fat, fiber, protein, phosphorus, antioxidants. Why do you need to have antioxidants when you don't have oxidants? Doesn't make sense, does it? A diet that is very low in oxidative stress, why would you need antioxidants? And so that's, yeah. Anyway. Nutritional adequacy, yep. Maintenance versus all life stages. Commercial diets. My 2 cents is just avoid carbs. Get as low carb of a diet as you can get for your pet. And if things get better, I was right. If they don't, then go back to what you were doing. I'm not a doctor, so, don't feel like you need to follow my advice. But I'm going to be a doctor one day. In 4 years. Okay. Gestation and lactation. Yeah. Takes more nutrients. Yep. Oh, here's something to keep in mind. A skinny pet has decreased fertility, but also a fat pet has decreased fertility. Guess what? It's the same in humans. A skinny, malnourished human has decreased fertility, and an obese human has decreased fertility. It's just how it is. Uh, car, hmm, calcium. Hmm. Yeah, if you don't feed your gestating pet enough food, they're probably not going to have healthy offspring. I mean, it's not exactly a puzzle. Um, okay, lactation, neonates. Be careful about feeding your pets cow milk because compared to the milk they received as a neonate or a baby, the cow milk has a lot more lactose in it. So that could cause diarrhea in your pet. Um, yeah, and then a lot of this is kind of just common sense and nature. Like animals are gonna wean eventually. The mom will start nipping at them or whatever, you know. I mean, I don't know why the curriculum makes nutrition so complicated. It's really not complicated. I mean, we didn't come up with all this stuff for wild animals. Why are the wild animals still alive? I don't know. Just something to think about. Anyway, calcium, phosphorus, puppies, AFCO. That's it for nutrition. Okay, onward to CCC. Let me find it here in my files. I haven't opened this one in a while. Okay. Oh. There we go. Okay. Low stress handling techniques. In a veterinary hospital, animals can get a bad perception of these clinics because of the way they're treated and how they're feeling. I mean, if I'm feeling sick or scared or in pain, I'm also probably not going to be as nice as I could be, or I'm probably not going to be as patient as I could be. Those sorts of things, you know? I mean, if your animal it's got a broken leg, yeah, it's not going to be comfortable. And it's in an unfamiliar place, so it doesn't help. Fear, pain, anxiety, frustration leads them to vocalize. So this is like they're barking, you know, they're yapping in the hospital, that sort of thing. Um, Destructive behaviors like tearing up their bed or something in a cage, you know, if they're hospitalized. Elimination, which means peeing or pooping in the hospital. Yeah, it happens. Attempts to escape, pacing, trembling, depression, self mutilation, restlessness. These are all things that people would probably do if they were in an uncomfortable place. And they're separated from what's comfortable, their owner. You know, someone they've had caring for them their entire life. They're unsure of their future. Are they going to come? Is my owner going to come back and take me home? Is this just my new life? That's probably the sort of things. Animals are a lot smarter than we give them credit sometimes. Okay. Barking, whining, vigilance, anorexia, which means no eating, trembling, pacing, Yes. In humans, there is a correlation between stress and compromised health. So if you are chronically stressed, there's a great chance that your health is going to deteriorate. You might develop autoimmune diseases, heart diseases, you might age prematurely, you might have digestive problems. For example, test taking diarrhea, that's a real thing. Uh, yeah, it's like you literally, but right before you take the test, you're so stressed and nervous that you feel like you got to go number two. And you do. I mean, it's your body makes you, yeah, it's pretty crazy how that works. Shortened lifespan from stress. Substance P. What is that? Substance P is a neurotransmitter secreted in the amygdala. It has an excitatory effect on aggression as an emotional response, leads to rage. And it happens because of pain, nausea, mood disorders, anxiety, or stress. Dogs that were euthanized due to aggression were found to have a greater number of receptors for substance P in their amygdala compared to control groups. Pretty crazy. So how can we help? How can we help our pets in these environments to not be as stressed? Well, there's three ways. Handle them in a way that's not as stressful. Make the environment more accommodating. And then use drugs. Sedation, anesthesia, that sort of thing. Okay, so these are things like wrapping a cat in a burrito blanket, right? Or a scarf technique. Maybe we can be less noisy. Maybe we can offer less visual stimuli. Maybe if it's a large breed of a dog, we can just, instead of lifting it up onto the exam table, just work with it on the floor. Matter of fact, exam tables are kind of not really beneficial anymore unless you're dealing with a cat or a very, very small dog. Because it's just stressful to lift an animal up from the ground on the table, especially if they're heavier. Puts more stress on the parts that you're literally holding as you lift them. Environment, toys, comfy blankets, walks, taking them out on walks, time with their owner, playtime, that sort of thing. Positive reinforcement. So, aggression. If you've got a dog that's yawning, blinking, or licking its nose, it's unlikely that that dog is aggressive. That's very low on the aggression ladder. Now you go up, going up the ladder, we've got turning its head away from you. Well, it's starting to get a little nervous. Now it's turning its body away from you. It's sitting and maybe pawing. Oh, it's okay. That's walking away from you. Creeping. Its ears are back. It's like getting a little nervous. Standing crouched, tail tucked under. Lying down, leg up. Ooh, I've seen this one before. My family used to have a Chihuahua that would do this all the time. I've never seen that with other animals. It's an interesting one. Lying down, leg up. Stiffening up or staring. So this is where the dog just starts looking at you, okay, like that's when you know, okay, this dog is very aggressive. I better get away because you're about to start experiencing these next ones I'm going to talk about. Growling, snapping, which is where the dog acts like it's going to bite you, and then biting, where the dog actually bites you. No one wants to get bit. And so, you know, just try and avoid aggression with these dogs. Be careful when you're handling these pets. Something that would help a veterinarian is teaching their client how to clip their own pet's nails. What does that do? That saves the client money, and that also is less stressful because it's not something they're unfamiliar to. They're familiar with their owner, right? And they're probably going to be doing it at home, so that helps. The 5 minimal requirements for pets. 5 freedoms, I guess. Freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, and disease, and freedom to express normal behavior, and finally, freedom from fear and distress. You know, these are things people should be able to experience. Now you want to give the animal an appropriate diet and water, an appropriate environment, treatment for whatever they've got, and a diagnosis for whatever they've got, and then space, environment, and companionship, and then psychological support. Okay, and then on to surgical instruments. This is something I really need to review. So scissors, surgical scissors, and clamps have usually handles, they have ratchets, they have shanks, they have a box lock or a joint, they have jaws or blades, and they have tips. Okay. Now for thumb forceps. Thumb forceps have tips, they have jaws, they have a joint, they have shanks, and they've got the handle. There's no ratchet in thumb forceps though. Needle holders, many different kinds. Mayo Hagar, Olson Hagar, Matthew, and then Castro Viejo, which is used for ophthalmology. What are they for? Well, it's in the name. They are for holding needles. Okay, and they're also used to arm and disarm scalpels safely. The Mayo Hagar needle holder is sturdy, blunt. It's sturdy, it's heavy duty, it's got blunt, short jaws with a mildly tapered tip. It's got no cutting blade on it, and it comes in various sizes. Mayo Hagar. The Olson Hagar needle holder is moderate duty, not as heavy duty as that other one. It has cutting blade at the base of the jaws, and this may be a disadvantage sometimes because you might inadvertently cut the suture while you're working on it, or while you're suturing. Next, we have a Matthew needle holder. It's got slim tapered jaws. This is used more in precise suturing tasks. No cutting blade. It's got a ratchet lock at the proximal end, and you squeeze the handles using a palmed grip instead of the thumb and ring finger grip used in other tools. And you want to hold the needle at the tip of the instrument, not in the middle of the grip. And you want to hold it about a third to half the distance from the swaged end. Not anywhere other than that, because you don't want to bend the tip, and you're not going to have good control if you're holding it on the other side. Again, you hold it with a tripod grip, which is the thumb and ring finger. You hold it at the distal phalanx, distal interphalangeal joint, which means the joint in between the phalanges. What does this do? This increases mechanical advantage and it improves control. Okay, and then there's different scalpel handles and blades. We've got, well, I can't show any of these, unfortunately, so I'll just move on. What are scalpels good for? Well, they're the surgeon's main cutting tool. They're the least traumatic way to divide tissues. Best for cutting or incising dense tissues or tissues that are held under tension while making the incision. And there's number 3 handle, which is used for small animals, and then there's the number 4 handle, which is used for large animals. And there's many, many, many different blades. Okay, there's the fingertip grip, which you basically hold like this. Think of there being a scalpel in between my hand here. You have your finger right above the blade so that you cut. If I'm cutting this, for example, then I'd cut like this. Then there's the pencil grip. You literally hold it like a pencil. Let me use a pencil to demonstrate, as a matter of fact. So this is the fingertip grip for a scalpel. If you're cutting something, that's how you cut. This is used for long incisions. Smooth. It maximizes the blade contact with the tissue, and it's the most common grip. Next, we have the pencil grip. You literally hold it like a pencil. You know, just like I'm holding a pencil, right? I'm holding a pencil right now. And you cut like that. This is used whenever you're making shorter incisions. It's very controlled. And these are for, again, smaller, shorter cuts. You're just making small cuts. Your fingers move in this one, and that's something I forgot to mention in the fingertip grip, is that your arm is moving. Whereas in this one, you're doing this sort of thing, you know, you're moving your fingers. Okay, scissors. There's different kinds again. There's Mayo scissors, which can be curved or straight. They're strong scissors. They're used for cutting dense tissue, like connective tissue or fascia. And then there's Metzenbaum scissors, which are a lot longer. They can be curved or straight. They're thin and delicate, and they've got a long handle, like I mentioned, long handle to blade ratio. These are used more for cutting delicate tissue and blunt tissue dissection. They are not for cutting suture or dense tissue because that can dull the blade. Then there's bandage scissors. Bandage or Lister scissors. They've got a blunt nodule at the tip. These are more, they're made to cut the suture, or the bandage, sorry, and they're made not to cut the patient. They're made for bandage removal. And then you got suture scissors. These are obviously for cutting suture. There's a notch in the top of the blades. to, hook the suture and then cut it whenever you're removing suture after a wound is healed. With scissors, you also hold with a tripod grip. It increases your control and mechanical advantage. And then thumb forceps. These are for grasping tissue during surgery. They're kind of like tweezers. They don't lock. They have a grasping surface. Sometimes they have teeth, sometimes they don't. And these are held with a pencil grip in the non-dominant hand. I am talking about, well, right now what I'm doing is I'm studying for vet school. The reason I'm making a video about it is maybe I can help some other people, and it helps me teach it to other people. While I might actually be teaching it to other people, I'm also just the process of teaching helps me study. It's actually a way to study, is teaching it to other people. But anyway, this is vet school, and right now I'm going over surgical instruments. I need to know surgical instruments for vet school. Okay, one kind of thumb forceps is the Adson forceps. They have rat tooth tips that come together like this. They grasp tissue gently, and they help during suturing to manipulate the soft tissues. And then you have Adson Brown forceps, similar to Adson forceps, but they have multiple teeth. So like if this is the forcep, there's multiple teeth along this part rather than just a single tooth here. Then we have rat tooth forceps. These have larger interdigitating teeth. This is mainly for grasping dense tissue, and it's not a good idea to use these for delicate tissues. These ones kind of look like this. If my fingers were the same length, this is how it would come down. Like there's two teeth on the bottom and one on the top. Then there's DeBakey forceps. They're striated in a longitudinal direction. These are a lot more delicate. Okay, next we have hemostatic forceps. These are good for occluding bleeding. But you got to be careful, because literally what they do to stop that bleeding is they crush the tissue between their jaws. These are similar. Let me move on here. They're similar to hold on. Where is it? Okay, I guess they're similar to needle drivers. That's what I was thinking of. But they're not the same. They're used for a different purpose, and so they are different. Okay, hemostats. Yes. First, we have the Halsted mosquito hemostatic forceps. Basically, the jaws go all the way along the length of the forceps. These are for pinpoint occlusion of small vessels. Next, we have Kelly hemostatic forceps. These are similar to mosquitoes, but they don't go all the way down. They're less delicate and larger. However, it does provide a less traumatic grip. Not dramatic, but traumatic. Less traumatic grip. Next, we have the Cryl hemostatic forceps. These are curved. They're like mosquitoes where they go all the way down, but they're curved. It looks like they can also be straight. Um, they're larger and less delicate than mosquitoes. They've got transverse serrations along the entire length of the jaws. They're super long. That's the thing to know here. There's a saying, "Cryle goes a mile," in the case of these hemostatic forceps. Okay, then there's Rochester Carmalt hemostatic forceps. These have a lot different design. If it were legal to show you these pictures, it would make more sense, but Rochester Carmalt. Okay, then we have Rochester Peen. Rochester Ochsner. They've got like a little tooth at the end. Wow. Okay. And there's a whole list here. I really hope I don't need to know this whole list of comparisons. Okay, then we've got tissue forceps. What it does is it provides a secure hold for prolonged periods. You only want to use these, well, and it depends on the kind of forcep. These specific ones are called Alice tissue forceps. You only use these on fascia or connective tissue. Next, we've got Doyen intestinal forceps. These are a lot more delicate because, as the name suggests, they're used on the intestines. And then we've got, okay, that's it for tissue forceps. Next, we have towel clamps. These are the things that secure the drape onto the animal during a surgery. And once they penetrate the drape, they're considered contaminated. Okay, one kind are backhouse towel clamps. They have sharp points. Next, we have Lorna Edna towel clamps. They don't perforate, which minimizes the risk of contamination in the surgical field, but you don't want to use them on the skin because they cause a significant crush injury. Okay, next we have retractors. These improve visibility by holding tissues out of the surgical field. So literally, this is like if I were to take my fingers and do this, that's retraction. So like say I'm sticking my fingers into a rubber band. Well, I'll just show you actually. I've got a rubber band in my backpack here. So say this is the surgical hole and I'm trying to retract it open so that I can see better. So I put a retractor in it and then I retract. That's what retraction is. And so these retractors are what do that. So we've got a Parker retractor. The blades are kind of blunt. They've got C-rounded tips. Next we have Army-Navy retractors, much larger. It's got a flat perforated handle. It's got a blunt, broad 90-degree angled, it's got blunt, broad 90-degree angled blades on each end. And it is used to retract large muscle groups, whereas the Parker retractor is used primarily in superficial soft tissue surgeries. These are handheld retractors, by the way. Next, we've got the Senn retractor, S-E-N-N. How to get a Superman-like jaw. Thank you, first of all. Second of all, the biggest thing is, well, I don't know your body fat percentage, but getting an optimal body fat percentage is the first step because, a lot of neck fat, if I had a lot of neck fat, obviously, it would decrease the definition to my jaw. You know what I mean? And so losing body fat and then also building those muscles there. I got a piece of gum. See those? Those help with the definition a little bit as well. So chewing things that can strengthen those muscles. That's why I chew gum. Not just for that reason. That's actually not one of the reasons I first think about, but primarily to freshen my breath and clean my teeth. Yeah, that's probably what it is. I do chew gum a lot. Ooh. Hold on, there's an emergency alert that just appeared on my phone. Sorry about that. Emergency alert. Okay. A Senn retractor, SENN. It's double-ended, and it kind of, how do I, it's like, is that, yeah, it's like this. It's kind of shaped like this. This is exaggerated, but it's got like one end that goes that way and then another end that goes that way. Very interesting design. Used for retraction of skin and subcutaneous tissue. And then there's self-retaining retractors, like the Balfour abdominal retractor. It's used to retract abdominal wall during surgery. And it holds itself, basically. You don't have to hold it there yourself. Then there's the Gelpi retractor. It's got kind of like sharp teeth that do that. It's got a ratchet, which maintains the retraction, that sort of thing. And then there's suction tools to remove fluid from a surgical site, or like if you're flushing out a site to remove that flush, that lavage. The first one is the Frazier suction tip. This is for precise suction. Used in neurosurgery. Wow. Oh yeah. Yeah, that's awesome. Uh, I don't know. No one's ever called me looking, or no one's ever said I looked like Superman before. I appreciate that. I've been trying to work out too, so I mean, you can't really see the rest of my body, but I don't know if I look like Superman musculature wise, but anyway. Next, we have the Poole suction tip, Poole. These are all named after somebody. This is designed for rapid removal of large volumes of fluid. It's got like little holes in the pipe, perforations in the sleeve. And it prevents clogging because of the multiple perforations. Okay, then there's specialized tools. There's the sponge forceps. They can be straight or curved, made for holding sponges. Wish I could show pictures. I can't. Then there's the Snook spay hook. It's literally only for spays. That's the only purpose. It's used to retrieve the uterine horn during an ovariohysterectomy, which is another word for a spay. Okay. Then there's certain knots and suturing patterns. I am teaching, well, yeah, I guess I am teaching I'm also really what I'm trying to do is study, but I'm kind of just like regurgitating what I'm learning. I'm reading my notes and I'm studying my notes and I'm teaching whoever wants to learn. Vet school. So this is veterinary medicine. Currently, I'm going over clinical skills, so suturing, tools used, instruments, veterinary instruments, and types of knots, that sort of thing. So yeah, yeah, and yeah. There's a lot more than just clinical skills though. Like earlier, I was going over. Wow, it's already been 55 minutes. I guess 30 minutes ago, I was going over nutrition. So, okay. So, before suturing, you want to make sure the incision is oriented horizontally and you suture toward your non dominant hand. Okay, so like if you're right handed, you're going to be suturing to the left. And if you're left handed, you're going to be suturing to the right. You're going to have the needle holder, the suture needle, the thumb forceps. Yeah. The knot is the weakest part of the suture line. Tying it properly is very, very important. I'm kind of just going to skip past all this because there's no way I can. I mean, I can't show the pictures because it's illegal because they're copyrighted by my professor, that sort of thing. And it's kind of just hard to talk about all these. And no one really needs to know about them anyway, unless you're a veterinarian. Yeah, what I was talking about was the mosquito. Well, I already forgot it. Let me go back to that real quick. So those were in the hemostatic forceps. Halsted mosquito hemostatic forceps. So hemo means blood, static means stop. Blood stopping forceps. So it's literally what these hemostats are for, or hemostatic forceps are for, and there's many different kinds that I was talking about earlier, but they are for occluding small blood or any blood vessel, but the mosquito ones are for small blood vessels in particular. Like if there's bleeding that's happening at an artery, well, if the patient bleeds out, that's not very good, right? And so, say you accidentally cut an arterial wall. There's many other paths that the blood can take to get where it needs to go, usually. And so, you occlude, which means you clamp, basically, or you pinch that vessel, and then the bleeding stops. That's the purpose for those. Okay. Measurements. Suturing. Weight estimation. It's important to be precise. Wow. Especially with suturing. Okay, that's it for that. Now, finally, I'm going to get to what I was going to do today, which is going to review my practice immunology exam since I've got a real immunology exam tomorrow. Second exam this week. Fourth exam these past 2 weeks. Crazy. Anyway, what best describes the primary function of pattern recognition receptors, or PRRs? The answer is they detect distinct molecular patterns shared by various pathogens or released from damaged host cells. This is going to take a while. There's 60 questions here. Which receptor on macrophages binds antibodies and promotes opsonization-mediated phagocytosis? The Fc receptor does. Number 3, gamma delta T cell receptors are unique because they recognize lipid or glycolipid antigens via CD1. I don't know what CD1 is, I'll be honest. There's so much I've got to learn, and it's all for the exam tomorrow. I don't think I have time. Oh, I probably do have time to learn that. I probably should. I probably will. I just don't want to. Anyway. Oh, that is awesome. Wow. So in zoology, you pretty much, I guess you have to know, is it true that you have to know everything about every animal, or are there things you don't have to know? Like, you probably need to know a bit about the circulatory system. For example, in anatomy, in vet school, we're only really going over the cat and dog, but we're going so in depth, so in detail. Like, we've got to know every single branch of the main channel artery that goes down the brachium, every single branch off of the main channel artery that goes down the pelvic limb, which is the back legs. It's crazy. We've got to know every branch of nerve, and we just started the pelvic limb, so I mean, I don't know. I can't really tell you any of these things, but we got to know every muscle in the pelvic limb. Some, for example, the middle gluteal muscle, the superficial gluteal muscle, the deep gluteal muscle, the piriformis muscle, which is around the gluteal region. And those were just the gluteal muscles. Next, we've got leg muscles. So I'm trying to think here. Okay, so you've got the vastus lateralis muscle. These are the four muscles of the quadriceps femoris. Vastus lateralis, rectus femoris, vastus intermedius, and vastus medialis. Then you've got the semitendinosus, the semimembranosus, the gracilis, the adductor, the pectineus, the sartorius, and that was just the thigh. Now you've got to go to the calf muscles. You know, it's crazy. Oh, wow. That's very interesting. Yeah, I love animals. Yeah, I can imagine. Yeah, learning all that stuff, because it's probably so intense too. Vet school's pretty intense as well. But I mean, it's a graduate program, I guess. So at least I'll be a doctor. Okay. Gamma delta T cell receptors are unique because they recognize lipid or glycolipid antigens via CD1. Good to know. Which adhesion molecule pair mediates firm leukocyte adhesion to the endothelium? LFA1 to ICAM1. Didn't know that. Which characteristic of adaptive immunity receptors allows vast antigen recognition? variable regions for diverse receptors. What do TCRs recognize? They recognize short peptides on the MHC, which is the major histocompatibility complex. What do BCRs bind? They bind proteins, carbohydrates, nucleic acids, and lipids. Basically anything that's native from a foreign thing. At least as long as it's in their native state, they can bind it. PRRs recognize what patterns? They recognize MAMPs and DAMPs, which are microbe-associated molecular patterns and damage-associated molecular patterns. What's the difference between B and T cell antigen recognition? Well, B cells bind native antigens, and T cells bind peptides on the MHC. Okay, I'm actually going to end this one here and just start the next one. Just makes me feel more accomplished because I've got 2 videos to do today and this is my first one. So thank you for watching. Hope to see you in the next one.